Hello friends, I am Dr. Maneesh Gupta. I am a psychiatrist and psychotherapist based in Dwarka and Uttam Nagar, Delhi. As promised in a previous video, this video is about the different types of psychotherapy. It is a brief overview and does not necessarily delve into the greater details of each of them. I would like to introduce psychotherapy in a graded form. So let me try and take you from a simple to medium to more complex forms of psychotherapy. And the simplest form of psychotherapy is called supportive psychotherapy. This is more about supporting, facilitating, and helping an individual to recover and rehabilitate into normal life after they have gone through a big situation. And usually, in my practice, that situation is having bipolar disorder or having schizophrenia. And supportive psychotherapy works extremely well for my patients because I work with them on two aspects. One, to support them to take medicines regularly, consistently, on a sustained basis. And that is very important for the long-term outcome and well-being of people who have bipolar disorder or schizophrenia. The second aspect of supportive psychotherapy that I work upon is to help people make choices which are in consonance with the diagnosis of bipolar or schizophrenia or complex depression. So once we know in the past 6 to 8 months while we were treating them for their illness, psychotherapy can now work helping them to recover into the normal functional life that they were leading before depression or schizophrenia or bipolar hit them. And that requires a gradual approach towards recovery. Step by step, brief steps, small steps, baby steps, but taking steps nevertheless each day, each week, focusing only on what they can achieve today, and then gradually adding to that further steps so that they build up and become better and better gradually. Supportive psychotherapy does not have any structured pattern. It is very individualized depending on what you want to do, what your moods are like, what your strengths are, what your challenges are, and what your situation is like. Therefore, I assume that when I've treated you for bipolar, I would have known you and get to know you as a person in total. What mental strengths you have, what social strengths you have, what supportive systems you have, and within that I would be helping you to choose and find a path towards full functional recovery. Now, from supportive psychotherapy, a next level of psychotherapy to slightly medium to simple complex situations is interpersonal psychotherapy. Now, interpersonal psychotherapy focuses more on the interpersonal situations that you face every day or suddenly in a situation. So, for example, you work in an office and you are finding it difficult to adjust to the working environment, you're finding it difficult to work with colleagues, your boss is a little demanding for you, or you're unable to motivate yourself, you're unable to feel enthusiastic about it. It is these problems which we would focus in an interpersonal psychotherapy situation. Apart from that, any role transition, for example, after working for 3 years, suddenly you have now chosen to become a mother, you are at home, you're taking care of a newly born infant, and that is causing you some problems, suffering, distress, changes in emotions, anger, irritability, guilt, whatever. Interpersonal psychotherapy would be the choice at that stage, helping you to look at what you can do and choose to not do what you cannot do, and then have the wisdom to have made the right choice and leave the rest to God. Something of that sort. Interpersonal psychotherapy is also often used to help people who are recovering from grief or breakup. More often these days, we see people having had problems in moving on after a relationship has broken down. And that is where we try and help the person to focus on what is good in life today rather than what was good when the relationship was ongoing. And at the same time, also not to focus on what went bad and why it went bad, but to be able to accept that the relationship has broken, has finished, the other person and you have to now move on. And then think of what strategies you can use, what options you can use in life, where you can divert your mind, where you can engage your mind, where you can enjoy the real situation that you have, which is that you are single and available again. And for viewers who understand that these situations, these breakups are becoming more common, and sometimes they occur with a lot of toxicity, which further burdens one of the partners and further makes it difficult for them to move on. My role as an interpersonal psychotherapist would be to help them choose to move forward rather than continuously looking backward. But after interpersonal psychotherapy, if you move further upwards the ladder towards something more, slightly more difficult, then we come to cognitive behavior therapy. Now, cognitive behavior therapy is one of the terms which is widely used by people these days. Apparently, the internet informs them that it has the best evidence, it is one of the best therapies, it treats you without medicine, blah blah blah. It is a good therapy, yes. It works in depression and OCD when it is done by the best trained CBT therapists and when it is offered to people who are the most suitable for CBT. CBT stands for Cognitive Behavioral Therapy. Remember, CBT is a very structured therapy and therefore it is not useful and not recommended for those whose minds are not yet able to focus on one task or to be able to remove the other thoughts and try and consolidate their thoughts, feelings and behavior on what we are offering them. A task to do, a thing to change, something to reflect upon. If you cannot do that, CBT won't be successful. And if your therapist cannot be a little hard, structured and objective with you, then CBT doesn't work. And as I said, CBT unfortunately does not work for 90% of people who have emotional and behavioral disorders. Primarily because the disorder in our mind makes it itself difficult to be able to organize our emotions or focus our behavior on one specific thing. It's not easy, which is why you're seeking treatment, which is why CBT does not work. So it's a paradox, but that is where our assessment and our recommendation to you for the kind of therapy that we should offer comes into play. The CBT does have a very robust evidence in OCD. OCD is obsessive compulsive disorder. But once again, the best evidence is on people who have compulsions, which are actions they do repetitively because of anxiety inside. Their CBT will focus on how you can reduce the intensity of repetitive behaviors that you do and how you can overcome the anxiety within yourself by thinking positively. But CBT is structured, and therefore OCD is something which makes you rigid. And perhaps that is why CBT enforces boundaries on that very rigid thinking, helping it narrow down the thought processes and therefore eliminate unwanted behaviors. But please remember, CBT does not work very well on people who have obsessions, ruminations, mental rituals, who are very anxious. Moving on from CBT, the even more complex mental disorders, personality disorders require psychodynamic psychotherapy, and even after that we have psychoanalysis. Now, psychoanalysis is something that I will not be able to comment upon. Psychodynamic psychotherapy is one of the long-lasting therapies which requires us to delve into your childhood experiences, your growing up years, your working years, your relationships, and help to identify what makes you not tick as a person throughout the years. So usually psychodynamic psychotherapy would be in people who are 30, 35, who are aware that there is a problem in the way they behave or think or feel, and that problem is long lasting. That problem stems not from today, but stems from some subconscious beliefs, thinking patterns, subconscious ways of actions that have been entrenched into the mind over the last many years. And during psychodynamic psychotherapy, we would try and make them aware of what those unfortunate tendencies and schemas in the brain are, and how we can unravel, disseminate them, how we can disrupt those adverse maladaptive strategies and replace them with adaptive, correct, modified strategies which do not trouble you or your loved ones, which help you to progressively move further in life, which help you to become better human beings, a better partner, a better mother or father, a better work colleague or boss. Right? So these are basically the kinds of therapies that we do. The caveat, as always I say, let your therapist assess you, and your therapist will offer you the best choice of therapy that you need, right? And not something which you have read on the internet or which your friends have suggested or which your work colleague has said works on him or her. You are an individual. Let me assess you for the problems you have and for the solutions that would best work for you. If you like this video, then please press like and subscribe to the channel. That would be great for me. Thank you.